using didactic techniques, let's talk about TMJ anatomy and focus on skeletal anatomy. This is a complex diarthrodial joint. It slides in the superior compartment. This is also known as translation. It rotates in the inferior compartment. The internal components of the TMJ include its articular surfaces, its biconvex or concave disc, depending upon how you look at it, the joint compartments, the capsule, and the ligaments. The space in which the condyle sits is known as the condylar or mandibular fossa. In front of that sits on this sagittal CT the articular eminence. The articular eminence continues forward as the preglenoid plate. In the back, there'll be attachments, and we see an upper and a lower attachment with the meniscus or disc on this colored diagram. The upper attachment connects to a small ridge, which is ill seen or poorly seen right there, known as the postglenoid process or postglenoid plate area. The anterior portion of the disc is attached to the superior aspect of the lateral pterygoid. Although not shown, the inferior portion or head of the pterygoid attaches to the condylar neck right here. I've drawn it in yellow with a somewhat robust yellow dot. Now on the lower image, you can also see the joint capsule, which is a little more robust than you might think and comes down about 2.5 centimeters from the tip of the condylar head. The lateral condensation of this capsule, which meets the pterygoid, is known as the lateral TMJ ligament. Behind the mandibular condyle is the styloid process. Although not shown, a suture or fissure comes down here, known as the squamotympanic fissure or suture, part of the squamopetrosal group of sutures or fissures. So we've got a head, we've got a neck, we've got an attachment in the neck, and we've got an attachment to the meniscus from the lateral pterygoid. The meniscus divides the space up into a superior compartment and an inferior compartment. Let's look at the coronal and axial projections. Pay no attention to the foramen ovale and spinosum, but let's look at the condyle, which in the axial projection looks a little more rounded medially, but in the coronal projection, it actually is a bit more pointed on the inside than it is on the outside. Now there's a rim or a bulge that you saw in the sagittal projection. Let's look at it right here, the articular eminence, and then the continuation forward of that eminence is the preglenoid plate. So that's hard to discern in the axial projection. Let's go back to the axial projection because there is another important process known as the entoglenoid process, which is this medial little point that provides support to the medial aspect of the mandibular condyle. One also sees how broad the condylar fossa is from medial to lateral, and it's in this projection where you may diagnose direct lateral and direct medial meniscal subluxations. And we finally finish with a three-dimensional image, and I'd ask you in your mind's eye to draw the joint capsule over it. Let's do that together. So the capsule is going to come down from the pterygoid, which has been taken away. It's going to come about 2.5 centimeters down around the mandibular neck, and then reflect back up and have an attachment that's reflected off the back of the temporal bone. That capsule is then going to be divided into an upper and a lower compartment. Let's pick a nice color that we can see by the meniscus. So here's our meniscus. It'll be ensconced in this capsule in blue. So we're going to have capsular tissue that continues on up. This is all going to be capsule here. There'll be more capsule here. And you'll have the upper compartment here and the lower compartment down here. So you can inject here and not fill down below, or inject here and not fill above, unless you tear through the meniscus or you tear one of its attachments in the back, which I'll draw now just to be complete, an upper attachment and a lower condylar attachment. So that concludes our discussion of TMJ anatomy and skeletal anatomy, as well as the capsule. Remember, the inferolateral condensation of the capsule is known as the lateral TMJ ligament.